Imagine a sharp, shooting pain that starts in your lower back and travels down at the back of your thigh, leg, and sometimes foot. This agonizing sensation, often accompanied by numbness and weakness, can make even the simplest tasks feel impossible. This is the reality for millions of people worldwide who suffer from sciatica. Sciatica is not just a pain in the leg, it's a debilitating condition that disrupts lives, impacting work, relationships, and overall well-being. Welcome to Physio Healthcare, your trusted channel for physiotherapy tips. I'm Dr. Harry, and today we're diving deep into sciatica. If you're new here, don't forget to subscribe for regular insights that help you live pain-free. Let's get started. Sciatica is not a disease in itself, but a symptom of an underlying issue. It's a distress signal from your body, indicating that something is wrong with your sciatic nerve, the longest and widest nerve in the human body. Sciatic nerve originates in the lower back from 5 nerve roots, L4, L5, S1, S2, and S3, branching out through the hips and buttocks, and extending down each leg. When the sciatic nerve is irritated, compressed, or inflamed, it triggers a cascade of symptoms collectively known as sciatica. This pain can manifest in various ways, from a dull ache to a searing, electric shock-like sensation that courses along the nerve pathway. Understanding the mechanics of sciatica is the first step towards effective management and treatment. True sciatica, as the name suggests, directly involves the sciatic nerve, often stemming from compression or irritation of the nerve roots in the lower back. Imagine a garden hose responsible for delivering water to your plants. If a heavy object obstructs the hose, the water flow gets disrupted, impacting the health of your garden. Similarly, in true sciatica, something compresses or irritates the sciatic nerve roots, disrupting the smooth transmission of nerve signals. The most frequent offender is a herniated disc, affecting 90% of cases, where the soft, jelly-like center of an intervertebral disc pushes through the tough outer layer, pinching the adjacent nerve root. This pressure can cause inflammation and pain that radiates along the path of the sciatic nerve, often with numbness or weakness. This is also known as lumbar radiculopathy. While age and genetics play a role in sciatica's development, lifestyle choices also cast a long shadow, influencing the likelihood of experiencing this debilitating condition. Prolonged sitting, a hallmark of modern life, puts constant pressure on the intervertebral discs, potentially leading to disc herniation. Weak core muscles, often a consequence of a sedentary lifestyle, provide inadequate support for the spine, increasing the risk of injury and pain. Other culprits in true sciatica include spinal stenosis, where the spinal canal narrows. This narrowing, often due to age-related wear and tear, bone spurs, or thick ligament, which can lead to compression of the spinal cord or nerve roots causing pain, along the distribution of the sciatic nerve in both legs associated with weakness, numbness, or tingling, especially after prolonged standing or walking for a while. This pain improves with sitting, rest, or bending forward. This condition is usually seen in older adults. Another cause of sciatica is spondylolisthesis, a condition where one vertebra slips forward over another, pinching the sciatic nerve roots. Other causes of true sciatica may include fractures, pregnancy, or in rare cases, tumors. False sciatica, on the other hand, mimics these symptoms but comes from muscular or joint dysfunction, like tightness in the piriformis muscle or sacroiliac joint disorders. In piriformis syndrome, pain originates in the buttock and worsens with prolonged sitting or climbing stairs. The piriformis muscle plays a crucial role in hip rotation and stability. However, when this muscle becomes tight, inflamed, or spasms, it can put pressure on the sciatic nerve, which runs directly beneath, sometimes above, or sometimes even through the piriformis muscle, triggering the familiar pain, numbness, or tingling sensations associated with sciatica. Several factors can contribute to piriformis syndrome, including overuse, prolonged sitting, direct trauma to the buttock, and anatomical variations where the sciatic nerve passes through the piriformis muscle. Similarly, in sacroiliac joint syndrome, pain is located over the buttock and may extend to the posterior thigh, usually not below the knee joint. Sacroiliac joint syndrome can occur due to microtrauma or repetitive trauma. 80% of cases are seen in athletes due to overloading the sacroiliac joint. Other factors contribute to sacroiliac joint syndrome may include pregnancy, which represents around 15% of cases, idiopathic or unknown source, which represent about 4% of cases, and finally abnormality of the shape of the sacrum itself, around 1% of the cases. In sacroiliac joint syndrome, people describe pain as sharp shooting or stabbing pain that has no neurological symptoms such as tingling, numbness, or pins and needles. Sacroiliac joint pain is aggravated by prolonged sitting, climbing stairs, bending forward, or lying on ipsilateral or same side of pain. Sciatica is most prevalent in men aged 30 to 50, especially those with sedentary jobs or heavy lifting occupations. True sciatica usually radiates pain below the knee, while false sciatica stays localized to the buttock or at the back of the thigh, not below the knee joint. Diagnosing the root cause of sciatica is like detective work, involving a thorough medical history, physical examination, and sometimes imaging tests. Your physiotherapist will act as your guide, piecing together the clues to determine the underlying culprit and develop a targeted treatment plan. The first step in the diagnostic journey is a detailed medical history. Your physiotherapist will ask about your symptoms, including the location, intensity, and duration of pain, as well as any aggravating or relieving factors to narrow down the contributing causes to your sciatica. They'll inquire about your medical history, lifestyle, and any previous injuries or surgeries that could be contributing to your pain. Then, the physical examination will be performed, and it will involve assessing posture, range of motion, muscle strength, and reflexes. Your physiotherapist may use a combination of the following physical examination diagnostic tests. Straight leg raise test, reproduces nerve pain due to nerve irritation when the leg is raised. Crossed straight leg raise test, tests for disc herniations by raising the opposite leg. Slump test, stretches the nerve in a seated, slouched position to test nerve tension. Piriformis test, identifies piriformis syndrome by reproducing pain with hip flexion and internal rotation. Faber test, checks for sacroiliac joint dysfunction. Bowstring test, confirms sciatic nerve irritation by applying pressure to the back of the knee during an SLR. Heel and toe walking test, checks motor weakness in specific nerve roots. Dermatome and reflex testing, identifies sensory and reflex deficits for L4, L5, and S1. If necessary, diagnostic tools like X-rays, MRI, or CT scans confirm nerve root compression or other abnormalities. X-rays use low doses of radiation to create images of bones. They can reveal bony abnormalities such as bone spurs, spinal stenosis, fractures, or spondylolisthesis, facet joint syndrome or sacroiliac joint syndrome. MRI uses a strong magnetic field and radio waves to create detailed images of soft tissues. Nerve conduction studies, NCS, and electromyography, EMG, diagnose nerve problems by tracing electrical impulses. NCS measures how fast electrical signals travel along nerves. Electrodes are placed on the skin, and a mild electrical current is applied. The speed of this current provides information about nerve function. The following symptoms are considered red flags. If you identify them, then you have to seek immediate medical help or medical emergency. If you experiences sudden severe pain, numbness, or weakness in the leg or foot, or in the saddle area between the thighs. If you experience any loss of bowel or bladder control. This is a medical emergency. Prognosis for sciatica is generally good, and most sciatica cases improve within 6 to 8 weeks with conservative physiotherapy treatment. Your physiotherapist may refer you to a neurologist in the following cases. Your symptoms worsen despite treatment, or if your symptoms persist more than 8 weeks with no improvement. There's significant muscle weakness or loss of bowel or bladder control. Imaging reveals conditions like tumors or severe spinal stenosis. Here are 10 different physiotherapy techniques used to treat sciatica. Number 1. Dry needling. Releases trigger points in the muscles of lower back or piriformis that are usually tight when you experience sciatica. This modality is recommended 1 to 2 times per week for 4 to 6 weeks. Number 2. Shockwave therapy. Reduces pain in muscles and joints and promotes healing. This modality is recommended for 1 to 2 sessions per week for 6 to 8 weeks. Number 3. Joint manipulation technique for lumbosacral region. This technique helps to restore movement. It is recommended to do this technique 2 to 3 times per week for 4 to 6 weeks. Number 4. Spinal mobilization. A cornerstone of manual therapy for sciatica, involves gentle, rhythmic movements applied to the vertebrae of the spine to restore proper joint alignment, reduce stiffness, and alleviate nerve compression. Spinal mobilization acts like a lubricant, restoring smooth, pain-free motion to the joints of the spine. Number 5. Soft tissue massage. Relieves muscle tension in lower back and buttock area. This treatment modality would be done 1 to 2 times per week for 3 to 6 weeks. Number 6, ultrasound therapy also helps to reduce inflammation. It is recommended to be applied 3 times per week for 4 weeks. Number 7, cupping therapy improves circulation in soft tissues. It is recommended to apply 1 to 2 sessions per week for 4 to 6 weeks. Number 8, TENS. Machine provides pain relief by blocking tissue damage signals from reaching your brain. It is used daily for 20 to 30 minutes. Number 9, posture education. Prevents recurrence of disc herniation by correcting sitting and standing habits. Number 10, exercises for strengthening core muscles. Therapeutic exercises are key in sciatica treatment, harnessing the body's ability to heal through guided motion. They empower you to become an active participant in your healing, strengthening weakened muscles, improving flexibility, and restoring optimal movement patterns to alleviate pain and prevent future episodes. Think of these exercises as tools, each designed to address a specific aspect of your condition, working together to restore balance, strength, and resilience to your body. Stretching improves flexibility in muscles like the hamstrings and hip flexors, reducing sciatic nerve pain. Strengthening core, glutes, and back muscles provides spine stability, reducing future injury risk. Core strengthening, building a stable foundation for your spine. Imagine your core muscles, those deep abdominal and back muscles, as a sturdy corset, providing support and stability for your spine, like a strong foundation supporting a tall building. When these muscles are weak, the spine becomes vulnerable to injury, misalignment, and increased stress, potentially contributing to sciatica and other back problems. Core strengthening exercises, far from focusing solely on six-pack abs, target these deep, stabilizing muscles, building a solid foundation for your spine, improving posture, and reducing the risk of future back pain. Think of these exercises as strengthening the pillars that support a bridge, enhancing its stability and resilience against external forces. Here are a number of exercises you can do at home that will help you to manage sciatica. 1. Nerve glides. Sit with legs straight, flex the ankle, and bend the neck. Do 10 to 15 reps twice daily. 2. Balance exercises. Stand on one leg, hold for 20 seconds and switch. Repeat 2 to 3 sets daily. 3. Core strengthening. Plank for 20 seconds, increasing to 1 minute. Do 3 sets 3 times a week. 4. Glute bridges. Strengthen the hips by lifting them off the ground. Do 3 sets of 10 reps 3 times a week. If you found this video helpful, don't forget to like it, comment below, and subscribe to our channel Physio Healthcare for more healthy tips. Let's beat pain together, one step at a time. Thank you for watching. I will see you in the next video.